Why is the MELD score so important for liver patients? The MELD score, which stands for Model 4 and Stage Liver Disease, plays a crucial role for liver patients. It provides an objective measure of how severe a person's chronic liver disease is and predicts their risk of death within 3 months without a liver transplant. This score is essential for prioritizing patients on the liver transplant waiting list. It ensures that those who need a transplant the most receive donor organs first. The MELD score ranges from 6 to 40, with higher scores indicating more severe liver dysfunction and a higher risk of mortality. For instance, patients with a MELD score above 40 have an estimated 71.3% risk of death within 90 days if they do not receive a transplant. In contrast, those with scores below 9 have a much lower risk of about 1.9%. This quantification allows healthcare providers to allocate donor livers more fairly and effectively, which is vital in reducing waiting list mortality. Besides guiding transplant prioritization, the MELD score helps assess how urgently a patient needs a liver transplant. Patients with higher MELD scores are generally sicker and have a greater immediate need for transplantation. However, it is important to note that the MELD score alone does not perfectly predict post-transplant survival. Other factors, such as age, existing health conditions, and complications before the transplant, also influence outcomes. Originally, the MELD score was developed to predict survival in patients undergoing specific procedures. It has since been widely adopted for liver transplant allocation because it is based on objective laboratory values. These values include bilirubin, creatinine, and the International Normalized Ratio, which reflected liver function, kidney function, and blood clotting status. All of these are critical in assessing the severity of liver disease. From the perspective of liver health and liver cancer, the MELD score is particularly important. Many patients with cirrhosis and hepatocellular carcinoma, which is a primary liver cancer, requiring transplantation. The MELD system has increased the number of transplants performed for patients with liver cancer, improving their chances of survival by prioritizing them appropriately on the waiting list. However, the presence of liver cancer is considered alongside MELD scores and other clinical factors to determine transplant eligibility and timing. In summary, the MELD score is vital for liver patients because it objectively measures liver disease severity and short-term mortality risk. It guides the fair allocation of donor livers to those most in need and helps clinicians assess transplant urgency and plan patient management. By improving outcomes, the MELD score reduces waiting list deaths and facilitates timely transplantation. It is integrated with other clinical factors, including liver cancer status, to optimize patient care. Understanding and using the MELD score appropriately supports better clinical decisions and ultimately improves survival for patients with advanced liver disease and liver cancer.